tray. Okay, what we're trying to illustrate there is it's all about the armamentarium and keeping yourself organized. Have all the instruments you need. Um, we got the articulating paper, Explorer, college pliers, a mirror, and then usually with composites, the instruments are used to compact it or fill the tooth are usually plastic or Teflon coated instruments, and those will typically be black. This is the die-cal instrument. This is the etchant. Oh, I keep on to pick it up. Can everybody see it? This is the etchant. Okay, here's the die-cal. A and B you mix together on a mixing pad if you're going to use it. Okay. The other thing, there are 3 steps whenever you do a composite restoration. First, the tooth is prepped, then you rinse out all the debris, okay? You need your high volume evacuation, and you're going to use your air water syringe to spray out the debris. Now, I don't know if they do this at Pitt. Sometimes after that, they will actually rinse the tooth with chlorhexidine. Do you know if they still do that or not?
Okay. I've seen it, but I don't know.
Some offices will do that just to get all the bacteria cleaned out. It's an optional step. So once you have a clean prep, then the next step, remember, if it's prep, it's going to go down into the dentin, which means it's going to be porous. You have exposed dentinal tubules. Now, the difference between an amalgam prep and a composite prep is the composite prep can be more conservative. You don't have to literally put in undercuts and stuff. It's just about cleaning out where there is decay, and that's it, because you can have a whole range of the size of the prep, okay? And that's the beauty of the whole situation. You remove less tooth structure unless you choose to do so. Now, some people, dentists will still do a classic traditional prep. But that being said, after the tooth is prepped and cleaned out, the first thing you're going to do is etch it. And there's 2 etchant delivery systems. One is the gel, which most people use. There's a liquid etchant. I don't know anybody that uses liquid etchant anymore. And the disadvantage of a liquid etchant is the fact that it'll flow everywhere. You have no control over where it goes. Whereas the etchant, it goes exactly where you place it, okay? And that little sheet that everybody throws away whenever they get a new material, keep it and read it, because so many different manufacturers actually will say, all right, this tooth needs to be etched for 20 seconds, this tooth with our material needs to be etched for 30 seconds, whatever the case may be. So you follow the directions, you place it full etching over the dentin, the walls, everything of the prep. Leave it on for the manufacturer's recommended time, and then once that's done, you're going to use your air water syringe with the high volume evacuation to get all the etchant out of there, which is the gel. The best way to do it is not use a steady flow of just water. You want to blast it with air water, because gel will actually adhere to the area a little bit better. And if it gets down into the dentinal tubules a little more, just the casual flow of water is not going to get it out there. So you're going to blast it out a few times while the high volume evacuation is close to the prep. And that doesn't mean just do it 2 times, because it's going to take a little bit more for the gel to be removed. So let's just arbitrarily say the manufacturer says rinse for 10 seconds. You do that, and then you dry it off real good without desiccating the tooth. Remember, you just want to get the moisture out of there. If you try to dry too much for an extended period of time, you may stimulate sensitivity with the patient post-operatively. You can do a very small prep on a patient. There are very individual responses, or you can do a deep prep. And some patients, there's no rhyme or reason to it. They end up being more sensitive. So don't desiccate it. Just get all the water and moisture out of there and the etchant out of there. Then the next step is primer. Typically, they'll come in little bottles like this. I keep wanting to show you. You'll dispense these little containers here, protects it from the light, okay? Now, you don't have to worry about the primer. It's not affected by the light. But you may put a few drops in there, and then you put the bonding agent, a few drops in the next well. What you're going to do, most people will do like 2 thin coats of the primer. And again, the manufacturer will say, let it soak in for a few seconds, because you have to allow time to it to work. So it needs to be, remember, primer is hydrophilic, so it'll be attracted to water, and it'll go down into those dentinal tubules, so you have to give it a few seconds for that to happen. Once that's done, you're going to thinly blow some air on it just to make sure it flows there. But whenever you put primer or any liquids and stuff, remember 2 thin coats or 1 thin coat, depending on how you want to do it, is better than 1 big thick sloppy coat. It's like when you're painting. You want it to thin out a little bit. If you choose to use 1 or 2 coats and the primer, you allow a sufficient amount of time for the primer to go into the prep, then you're going to use your bonding agent. Your bonding agent is hydrophobic, so it'll be attracted to what primer is there, okay? So you use your micro brush, or whatever the case may be. These are the micro brushes, and remember, these can be bent at an angle so you have better access to the tooth and stuff. It doesn't have to be straight all the time. And then you're going to dip it into the primer, and you're going to lightly brush it over the tooth. You don't want to scrub, because once that tooth is etched and the primer's on there, the etching, the micro retentive areas that you've created are very fragile. So if you scrape them, you're going to close some up. So you just want to lightly put it everywhere, thin it out a little bit, and then you're going to cure it with the light, the curing light, for whatever the manufacturer recommends. Some people use 2 coats of the bonding agent, some people just do 1, just whatever the manufacturer recommends. Now, after that, you can start placing your restoration. There's 2 different ways to do that. Some people will put a flowable composite on first. The flowable composite will come in a little syringe like this, and you put a tip on it, like this, and it's flowable because it actually flows into all the little point angles and line angles in the prep, okay? The biggest cause of sensitivity when you do composite restorations is creating voids, okay? So what do you want to do to avoid that? Not everybody does this. They're going to place a thin lower layer of flowable on the floor of the prep and allow some time to flow into all those point angles and line angles, and then they're going to cure that with the light, okay? Then after that, you can start using your compactable composite, and it's usually dispensed with a gun, and you can pick different shades, stuff like that. Once you do the compactable, what you're going to do is load it in your gun, and I'll show you how you do that. Once the compactable is put in there, you're going to condense it with whatever instrument the dentist prefers for condensing, okay? And what you're going to do after you put the compactable in the prep, you're going to dip the composite compacting instrument in the bonding agent. And the reason you do that is because a lot of time while you're condensing, you get tug back. It'll stick to the instrument a little bit. But if you put bonding agent on it, it won't stick to the instrument, and you can actually condense it again into the line angles and point angles and things like that. Whether you fill the whole prep or not, or do it in layers, is going to depend on the depth of the cavity preparation, and that can vary with whatever material. Some of the newer materials, you can load up the whole prep, and with the advancement in curing lights, they can penetrate that. But I think what you'll find out, any prep that has any depth to it, they're going to use different layers. Now, how is it that you can continue to put layers of your composite on there? If you remember from your lectures, when you cure it with the light, there's going to be a layer, it's called the air inhibition layer, on your flowable or compactable instrument. What that means, if you fill up part of it and you would actually touch that with your finger, you're going to feel it sticky. And it's exactly what it says. It's an air inhibition layer. The air inhibits the curing of that surface. But by doing that, you're able to accomplish the fact that you have that uncured area, and you can put the next layer on top of that, and it will bond to it. That's the whole theory behind all this. And you want to try to shape the composite restoration the best you can, because with your instruments, your various instruments, and what instruments you use is going to vary from dentist to dentist. They have their own preferences. But you want to try to put pre-anatomy in it to minimize that. And then once that's done, you cure that surface and you can start your finishing. That's the whole process. Now, just for the sake of, you may run into this, let's say, for example, you're doing a composite in an area of the mouth where it's hard to reach. If you have the gun and your cartridge on it, things like that, say, for example, you're doing a class 5 restoration, sometimes when you get real posterior, it's hard to get all the instruments in there. So to avoid that, what you can do is dispense a little bit of the compactable composite restoration on a mixing pad or in this, and cover it up with light. Because remember, what happens is the extraneous light in the room will actually start to set the composite. So if you're going to dispense some there or put on a mixing pad, it needs to be covered. If you're using a mixing pad, what you can do is just get a cup or something like that that's colored and put over top of it. And then what you're going to do, since you have poor access to the tooth due to the size of the instruments, you can actually scoop up a little bit of the composite and place it in the tooth. But once you do that, you want to cover it up again. Remember, each time that you've dipped that instrument in the bonding agent, you need to wipe it off. Otherwise, it'll build up on this. And then remember, just from in the room, you're going to have an air inhibition layer and things are going to stick to it. So you have to clear that off. The other thing to mention is when you're using the curing light, you want to get as close as the tooth to possible, like 1 or 2 millimeters, without actually touching the composite material. Because if you touch the composite material, what's going to happen, it's going to build up on the end of your curing light and it won't be as effective, okay? So those are the things you're going to have to think of. Any questions about all of this? Does it all make sense? Okay. Are you just nodding to amuse me or what?
The more you do it, the easier it
Yeah,
gets.
it's like any new procedure you
This
have.
is like
You know, sometimes it seems overwhelming at first, but these are the academic steps so you understand that. Okay, we're going to move this over here, get this out of the way. Is that centered? Can you see that? Or?
pretty good, yeah.
You can actually enlarge that a little bit. Yeah, since we put out to pick up the whole tree.